all that. I remembered when we had actually reported the situation, because especially for the fact that it was life threatening. And then I remember the deputy commissioner of police then, a female, saying, "Are you sure you did not sleep with that girl?" And then Rufus said he has never. Of course, I knew he had never. It was mere gestures of, "Oh, why you sad? Come, let's go to this place. Let's do that." And then even when she was asked, she said no, that she had tried all she could. That Rufus is not even looking at her. Then why are you saying Rufus is the love of your life?
That is a delusion. It's a mental health symptom. The person will just have delusion of love. That's what we call it. So the person will just have that's what we call delusion of love, where she believes that this person is actually the love of her life. Some will not even see the person, but they will still believe that person sitting there, or maybe is the king of whatever, is the love of her life, and they will be telling you, convincing you here that person, that king you are seeing, is the love of my life. They'll be telling you. So it's a mental health symptom. We call it delusion. So clearly that's what Cynthia is suffering from. And you said she was in a mental health facility.
Yes.
She got better. Were you able to?
Yeah, she got better. She came to tell Rufus she forgives him, and then she loves him till she dies.
Okay.
And then I think as a then, Rufus was advised to call her sometimes, at least within those treatment periods, because a lot of times she became less responsive at some point, that they had to use Rufus to get her attention back.
As a form of therapy.
As a form of therapy, yes, for her. Over a period of time. Though it was quite challenging for Rufus also, because it nearly led to another mental illness for Rufus, because he was really challenged.
That what could be going wrong.
He couldn't concentrate either. And not just him, it affected every one of us. Like, in fact, even the housemates, the ladies around, everybody now, it got to a time that Rufus, once any girl wants to speak with Rufus, they'll just say, let Cynthia catch you, and everybody will laugh over it, And I think one of the things I was able to succeed with then was to stop and advocate against discrimination, because it's or what would you say about discrimination of mental illness?
So the problem about Cynthia was that people didn't notice in time. And then it got worse until the full-blown illness, and then is that full-blown illness that people are not seeing. Even the full-blown illness itself, because probably she had some good pre-morbid personality. She had gone to school. She knows some psycho, so she's still able to cope. So even the full-blown, people didn't really understand it, but she has really gone down, as in she has really gone sick. But
initially it wasn't easy, because I could tell you I was within the process from the very beginning. We met Cynthia together, and we used to notice she used to sit at one extreme corner, just making beats alone, never speaks with anybody. But then we spoke to her and we saw the bright smile. Very beautiful lady. Why are you always sitting idle there? So then Rufus tried to, you get, and then where we would have suspected was she's saying, "Don't touch that, don't sit there," is for Rufus, But we just felt, okay, maybe it's just normal. Okay, Rufus has done some things for her to at least. So don't sit on that chair. She got it for Rufus. Don't touch that. I made it for Rufus. At first we thought it was, probably she's just trying to tease.
I understand. Mental illness could be very, as in the way. So that's why our patients are interesting. Just like, as in every patient has their own peculiar way of presentation, and you just be alarmed that God.
This came in like love building up gradually. It wasn't that don't talk to him thing. It was so systematic. We wouldn't have suspected a mental illness in the first place.
I get. So it could be very.
How would you recommend that to actually try to study symptoms from the very beginning, just like you said, that we did not notice it early enough.
Early enough.
How would you have recommended that would look at it without misconception?
Okay. Well, as it's a tricky question, let me tell you, because where we meet people is we meet people as in what I want to say that okay, like NYSC now.
Okay.
Everybody comes into that place from from wherever.
Just anywhere.
And then you try to build it, especially that 3 weeks, what they call
Camping,
camping. And then you develop that intense relationship with each other and all that. I'm just trying to,
Yes.
So, and then such things happen. You might not really, one might not really know. You might not really know. I'm telling you. So it's not something that, you would, as in some mental issues, some mental symptoms, especially for the general public, sometimes it is not really, one cannot easily detect. Especially like this case of Cynthia now, wasn't really detectable easily. But showing compassion, people still understand along the line that something is awkward, something is wrong, and then then the things that you guys the treatment and code that you now eventually give her.
Okay.
So just trying to show compassion, just trying to understand, just trying to say that okay, things happen that people that will make that just the thing is that I think you should just first understand yourself and then try and understand other people's behavior and trying to say okay, this person's behavior, how wouldn't it affect me? When do I know that this is going from normal to something else, from depending on what you know about normality. Should I say it like that? Maybe maybe like that.
Yes, I understand you that way.
So that you should try and understand what you think, what normal behavior is in terms of your relations, how you relate with people, and
just
all
like
that.
Normality is relative based on your kind of experience.
Exactly,
and who you are.
Exactly. So once you start to perceive that things are not normal, if you're feeling awkward, talk to somebody else that you think may know. Or that I think is in that mental health profession, or a psychologist or a psychiatrist that says that this person might understand. Then depending, maybe the person will give you tips that okay, this is it, or you call the person for an interview or something, or maybe you should use this method with her. Maybe you don't understand her in this way and all that, and then give you tips on how you can maybe talk to her or improve your relationship with her. And if that is not working, you can say that okay, maybe the person should come for an interview or something like that.
Does your facility, Federal Medical Center, Abeokuta, does it have a kind of acceptance for people who work in just to make inquiries like this? For example, being in a relationship and then you don't understand what is happening, and you suspect it to be a mental illness. Is it possible to work up to a professional in your facility and then make inquiries on this without having to,
without having to do the bureaucracy of the hospital,
the getting of the card and things. I am not the one who is the patient right now. I can't get a card for someone who is not even in the acceptance that is a victim or a patient of mental illness.
I get. So usually what I advise is that okay, you should walk through the people that are very close to that person in terms of family members, in terms of classmates, in terms of as in if it happens in school, if it happens at home, family members in school, classmates and all that. So and then maybe religious setting, the people that are also in that setting that know. So if it happens at home, we are working with the family members. You can say that have they noticed that something has changed and all that. As in, you can be the one to actually ask them all this. This is what you noticed.
Yeah, bring them to the know.
Exactly that. Okay. This is what you noticed, but you don't know if that's how she has been or and all that. And then they will now say what they have to say about it, and then you now go through the normal channel. If it were in school, classmates, okay, also go through that same. But if it's a part one student now, or if it's just a fresh, you don't know, nobody really knows about her. So you can
the history.
So you can walk through the family members or just take the person straight to the counselor's office, and then walk through counselor's office to the health centers department, and they get the person to see a mental health professional if the person needs to see one.
Are there medical diagnoses for bipolar disorder?
Yes, it's a medical diagnosis.
Oh, cool.
It's a medical diagnosis.
So, the blood sample is taken, or MRI, or...
Okay. Well, we don't... Usually, most of our diagnoses, we diagnose them clinically. That means by talking to the patients, by interacting, by that. We don't have like something like a how do I put it? Like diagnostic interventions, like all these ultrasound and X-rays to be able to say, oh, this is where the lesion is.
Okay.
And then so we don't have all those, but there are some things in the technologically advanced place. Okay. There are some things that they do, like some MRIs, some that they can do that. It's like, oh, there's more blood flow here. There's less blood flow here, so maybe there's more activity in this, and so we think that, oh, this person is likely suffering from this. Because, and then of course your symptoms, what you've actually asked, your clinical questioning would also guide that, and also support it. Just to say that, this is what, but usually it doesn't. They are not diagnostic. It's your clinical. Is your symptoms, what the patient tells you, that makes you to diagnose the patient more. Others will just support, just like, okay, likely. But it's your symptoms, the symptoms that the patient presents with, that will give the diagnosis away.
Oh, okay. I was telling you before this show that I met Dr. Bumi Daoud at your facility. I'm not so certain if she's still there.
Okay.
What made me come to your facility then was this general body checkup. I do it often, which a lot of people would say, what exactly are you looking for? I hope you don't find what you're looking for. It's a lot of people even felt it was wrong to always go do checkups. Now, would you advise that people go do checkups for mental illnesses too?
Checkup. Yes, you can. Yes, one can, especially if you think that things have changed about you. Even if you don't think that things have changed about you, but just feel that you just need someone to talk to. It's like you having a lot of things bothering your mind,
yes,
and you don't know how to forge ahead.
Cloudy thoughts.
Exactly. So talking to someone, to a mental health professional, is like doing a mental health checkup. It's like helping the person helping you to click the dots of what you think is right and what in terms of your mental health. So very well thing that people should try to accomplish and should try to do a mental checkup.
Okay. Yes, you're still live on Mental Health Show with James Osuntoogun. You call me MC JERRYJAY, and live in the studio we have Dr. Tosin Lawal. Yes, you're saying that it's good to have yourself checked out medically for your general physical health, for your mental health. Yes.
And also for your mental health.
And also for your mental health. There's something we do on the show. We give out, I give out my number and our email address for people to contact us, for people who they need people to speak with, people who want to make inquiries on such situations, and then for people who actually feel they're suffering from one thing or the other, not necessarily they themselves, they could be reporting for someone else, and then we make a recommendation for professionals to follow them up or to facilities as the case may be. Would you consider yourself a someone to talk to?
Why not? Why not? Very welcome.
Oh, thank you very much, Dr. Tosin Lawal.
Very welcome.
It's really great to have you on this project. In fact, just to be in the studio with us today, it's really a challenging one for you, and we really appreciate your gesture of love. Thank you very much, Dr. Tosin Lawal.
Thank you. You're welcome.
Yes. So this is Mental Health Show with James. our time is fast spent. We would have continued over and over again. There's still very much more things to talk about, even in the bipolar disorder alone.